Good evening, good afternoon, good morning to wherever you are tuning in from. Welcome to Facebook's Neurology for Vets Journal Club. Thanks to Hallmark Advanced Veterinary Imaging for sponsoring this session. If you haven't attended one of these webinars in the past, why not? Anyway, the format of this webinar, similar to those in the past, is where we invite a rising star of the profession to discuss their recently published research work. And we are lucky today to have Dr. Bibbiani, who has recently published on the prevalence and characteristics of MRI of feline disc disease. So welcome, Leonardo, to this session. I'm just going to introduce you before you can get going. Dr. Bibbiani graduated from the University of Pisa in Italy in 2011, and he completed a one-year general rotating internship, followed by a one-year surgical internship at Gregorio VII Veterinary Hospital in Rome. So, okay. Very good. During this time, he developed a special interest in neurology and started his neurology training and completed an international visiting program at the Neurology Service of the North Carolina State University. He then worked in a neurology referral center in Rome for 4 years and then started at the Neurology Service of Annacura e Portoni Rossi. Okay, this is getting good. The veterinary hospital in Bologna, one of the meccas of European neurology there. So hello to our friends there. And that's where he completed a 3-year residency program in small animal neurology and neurosurgery in 2020. And it's where he currently works. Fantastic. Great to have you. It's a real pleasure. As you can see, Laurent Grossi is with us, and he's brought his lovely little cavapoo to the session. It's fantastic. Anyway, Leonardo, yeah, thanks very much for giving up your time. Great publication, and we want to hand over the reins now to you to talk about the study and what you found.
Thank you. Thank you very much. And okay. Okay, thank you. Thank you very much. Do you hear me? So thank you for the invitation and thank you for the opportunity to share with you our study titled Prevalence, Clinical Presentation and MRI of Intervertebral Disc Herniation in Cats. This paper has been published in the Journal of Feline Medicine and Surgery last September. So several post-mortem studies have reported intervertebral disc herniation as a common findings in up to 25% of asymptomatic older cats. However, studies investigating the prevalence of disease, of the spinal cord disease in cats, have reported a low prevalence of this condition in cats, representing only 4 or 5% of the spinal cord disease of cats. So the first intervertebral disc herniation in cats dates back to 1971. And since then, several clinical cases have been published, mainly as case reports or case series. And as you can see from this chart, an essential contribution to the knowledge of this condition comes from the last 6 years, with these 3 larger retrospective studies. The 2 on the left, describing the intervertebral disc herniation limited to the thoracolumbar spine region, and the other one focusing on a single type of disc herniation, the acute non-compressive nucleus pulposus extrusion. So despite available information about this condition has increased over the years, published evidence on disc herniation in cats remains limited. Therefore, the overall goal of our study was to determine of all the type of disc herniation in a large population of cats referred to our hospital in a 13-year period. More specifically, the aims of the study were to analyze the prevalence of disc herniation in both the general hospital population and among neurological cases, to report the signalment, historical data, clinical and diagnostic imaging findings of all the type of intervertebral disc herniation, and to identify statistically significant differences between the subgroups of disc herniation. Our two hypotheses were that intervertebral disc herniation would be considered an uncommon condition in cats, and the second one was that cats could suffer from different types of disc herniation, each one associated with a distinctive clinical presentation. So it's a retrospective study, and we collected cases from 2008 to 2020, and cats were included if a complete medical evaluation, so including both a physical and neurological examination, was performed, if they had a spinal cord neurolocalization and a diagnosis of disc herniation by MRI. For each cat, we recorded the following information, so information about signalment, onset of clinical signs, type and severity of neurological deficits, presence of spinal pain, and any traumatic event preceding the onset of clinical signs was recorded. The MRI of the spine was performed using either low or high field MRI, and the MRI study included at least 82 weighted and 21 weighted images on the sagittal and transverse planes. For the MRI findings, we classify disc herniation according with the type as disc extrusion, disc protrusion, acute non-compressive nucleus pulposus extrusion, and intradural intramedullary intervertebral disc extrusion. We recorded the location of the affected intervertebral disc space, and for the number, we divided cats into two groups, a group with single lesion and a group with two or more intervertebral disc herniation, so the multiple lesions. Intervertebral disc herniation included in the MRI field of view, but outside the spinal cord of neurolocalization were counted. Statistical analyses were performed, so we apply a key proportion test to compare type of disc herniation, neurolocalization, and number of intervertebral disc herniation, and a multivariate logistic regression analysis was used to assess the effect of sex, onset, neurological score and pain score, and number of disc herniation on the type. So for the results, we collected 43 cats, and 84% of them were domestic short hair, only 7 pure breeds, 3 Siamese, 2 exotic short hair, 1 Persian, and 1 Maine Coon. The population was quite balanced for sex, with almost 56% of males and 44% of female, all but 2 were natured. And the mean age of cats was 8.7 years, ranging from 4 months to 15 years. And we evaluated also the mean age of the two groups of cats. So for domestic short hair, the mean age was 8.4 years, and for pure breeds, 10.6 years. So the first aim of our study was to analyze the prevalence. So we found a prevalence of disc herniation in general hospital population of 0.23%. And the prevalence of this condition in neurological cats was 2.8%. Among the neurological cats, 213 cats had a spinal cord disorder, so 20% of them were diagnosed with intervertebral disc herniation. Moreover, among the purebred cats, the prevalence of disc herniation for the exotic short hairs was 4.17% if compared with the general hospital population, and 18.2% if compared with the neurological cases. The onset of clinical signs, details of the onset were available for 41 cats, and the onset was peracute in almost 60% of cats, chronic in 30% of cats, and only 4 cats had an acute onset of clinical signs. Severity of neurological signs was evaluated with the modified Franco score, ranging from the less severe, grade 1, to the most severe, grade 5 degree of neurological dysfunction. So half of the cats were graded 2, 7 cats grade 1, 7 grade 3, 4 cats graded 4, and only 3 cats graded 5. So we found for the severity of neurological signs a correlation between the neurological score and the type of disc herniation. As you can see from this table, we found that grade 1 was significantly associated with intervertebral disc protrusion. The most common neuroanatomical localization were L4S3 and T3L3, followed by C1C5, and no cats had the lesion localized at C62. So for the type of disc herniation, 50% of cats were diagnosed with the acute non-compressive nucleus pulposus extrusion, 28% with disc protrusion, and only 21% with disc extrusion. No intradural, intramedullary, intervertebral disc herniation was diagnosed. So the type of disc herniation was significantly associated with both sex. So for sex, we found that the acute non-compressive nucleus pulposus extrusion was more common in female, and intervertebral disc extrusion more commonly affected males. And we found an association also with the onset. So the acute non-compressive nucleus pulposus extrusion was more commonly associated with a peracute onset of clinical signs, and the intervertebral disc protrusion with a chronic clinical presentation. We found a total of 50 intervertebral disc herniations, and with a distribution along the spine of cats, as you can see from this table from the paper. And we divided cats for the number in a single group, composed by 39 cats, and 4 cats had multiple lesions. 2 of them with a multiple lesion presented an intervertebral disc herniation that was outside the segments of the neurolocalization. So for the number of disc herniation, we found a correlation with onset, both onset and type of disc herniation. So the single intervertebral disc herniation was associated with both diagnosis of the acute non-compressive nucleus pulposus extrusion and the peracute onset of clinical signs. In contrast, cats with multiple intervertebral disc herniation were statistically more affected by this protrusion. Of the 22 cats with a diagnosis of the acute form, 2 had an unknown history. So the remaining 20 out of 22 cats, only 2 cats had sustained a witness trauma, like falling from an height. Only 2 cats had signs of external trauma, like pelvic fracture or skin lesion, and half of the cats presented clinical signs after vigorous exercise, like playing or jumping. Spinal pain were present in half of the cats, and spinal pain was significantly associated with both neurolocalization and type of disc herniation. So cats with spinal pain more frequently had L4S3 neurolocalization and a diagnosis of disc extrusion. However, the absence of pain was associated with a C1C5 neurolocalization and a diagnosis of acute non-compressive nucleus pulposus extrusion. For the multivariate analysis, factors included in this kind of analysis were limited to sex and spinal pain, and both factors were significantly associated with the type of disc herniation. Specifically, males were predisposed to intervertebral disc extrusion, and moreover, cats with spinal pain had higher odds of a diagnosis of disc protrusion or disc extrusion. So in discussion, we discussed the results grouped by the aims of the study. So the first aim of the study was to analyze the prevalence of disc herniation. Few studies have investigated the prevalence of this condition in cats, reporting a rate from 0.12% to 0.26%. So the prevalence in the overall population of cats at our institution is 0.23, and agree with previous studies reflecting the low predisposition of cats to intervertebral disc herniation. Moreover, we analyzed the prevalence among neurological cases, and intervertebral disc herniation was diagnosed in 2.8% of all neurological cases and in 20% of cats with a spinal neurolocalization. These latter findings agree with this recent study evaluating through a clinical reasoning process the main differential diagnosis in cats that found that intervertebral disc disease was present in 19% of cats with a spinal cord disorder. However, these findings are in contrast with the previous data by Marioni Henry suggesting that intervertebral disc herniation should represent only 4% of this feline spinal cord disease. So this disagreement might be explained probably by the different study design and inclusion criteria, as the study by Marioni Henry included only cats with histological confirmation of the disease. The second aim was to report signalment. So for signalment, we found that domestic short hair was the most common affected breed, as previously reported in all published feline cases, and probably the higher predisposition of this breed reflects the greater proportion of this breed among the overall feline population. However, this recent study by De Decker identified Persian and British shorthair as being predisposed to thoracolumbar intervertebral disc herniation. In our study, when taking exclusively pure-breed cats into account, the exotic shorthair seemed to be overrepresented. So these three feline breeds belong to the same family group, the Persian group, and members of this family share genetic and general health features. So a possible relationship between the typical brachycephalic morphology and intervertebral disc herniation could be suspected, but further studies are needed to investigate this hypothesis. For the mean age, so the mean age of our cat was 8.7 years, and which is in agreement with the mean age of all the published feline cases to date, that was 8.3 years. And as previously reported in these two studies, highlights the occurrence of this condition in mature cats. But when considering each type of intervertebral disc herniation separately, the mean age of cats for intervertebral disc protrusion was 10.1 years, for disc extrusion 7.8 years, and for the acute non-compressive nucleus pulposus extrusion 8.4 years. So our findings are in accordance with distribution for age for middle-aged and older cats affected by intervertebral disc herniation and protrusion. So in literature, we found that the mean age of cats affected by protrusion and extrusion was 8.6 years and was similar between the two groups of cats. But the mean age of cats with acute non-compressive nucleus pulposus extrusion in literature was slightly lower, 6.5 years. We didn't find a predisposition of younger cats to acute non-compressive nucleus pulposus extrusion. Additionally, a different age predisposition to intervertebral disc herniation for breed was found in the study by De Decker, with pure-breed cats being affecting younger. In our study, we didn't find a statistical significant difference between the two groups for age, and probably this finding is related to the very low number of pure-breed cats in our population of cats. For sex, we found a strong association with the type of intervertebral disc herniation, with males being more prone to being affected by intervertebral disc extrusion and females by acute non-compressive nucleus pulposus extrusion. In cats, a sex predisposition to intervertebral disc herniation has not been reported, despite among published cases of intervertebral disc herniation extrusion, a male predisposition could be suspected with a male to female ratio of 1.8. However, a female predisposition to the acute non-compressive form has not previously been found, and only 8 out of 23 published cases were females. Similarly, in dogs, a strong sex predilection to EBDH has not been reported, but males and neuter females seem to be more affected. So several explanations for these findings have been proposed, such as a within-breed weight factor and the neuter status itself. In our study, body weight, which is probably greater in males and neuter females, could be considered a potential risk factor for developing intervertebral disc herniation, but larger studies are needed to evaluate and confirm this finding. In cats, 4 types of intervertebral disc herniation have been reported, with the disc extrusion and disc protrusion the most common types, followed by acute non-compressive nucleus pulposus extrusion, and only 2 case reports of intradural intramedullary intervertebral disc extrusion. In our study, we found only 3 types, of disc herniation, and surprisingly, the acute non-compressive type was the most frequent. This different proportion could be linked to the design of our study itself, which for the first time evaluate the distribution of all the time of all the type of intervertebral disc extrusion at the same time in a feline population. Moreover, a relationship between the type of intervertebral disc herniation and clinical presentation was confirmed by our study that was in agreement with the study by De Decker. So we found that cats with intervertebral disc protrusion had a longer duration of milder clinical signs than cats with the acute non-compressive nucleus pulposus extrusion. These findings were expected and reflect the different underlying pathophysiology. So we know that the intervertebral disc protrusion is associated with a gradual spinal cord compression without contusion, while the acute non-compressive nucleus pulposus extrusion is characterized by sudden focal injury to the spinal cord. So for the historical data, AMPE has been diagnosed in up to 75% of cats following an external trauma, as we can saw in this paper from Taylor Brown. In contrast, only 4 out of 22 cats of our study diagnosed with this type of disc herniation had been involved in a traumatic injury, while 9 out of 22 cats presented clinical signs during vigorous exercise. So according to our findings, strenuous activity should be considered as a predisposing factor to this type of herniation in cats, as it should be for dogs, and these finding could help clinicians to develop a list of differential diagnoses in a cat with a peracute onset of clinical signs, including this type of disc herniation, even in the absence of a history of trauma. Spinal pain that was present in half of the cats was a clinical sign strongly associated with the type of disc herniation. So we saw that cats with disc extrusion more likely display pain than cats with the acute non-compressive nucleus pulposus extrusion. So spinal pain may be considered a useful clinical sign in a cat with a sudden spinal cord disorder, and according to the clinical presentation, may support the suspicion of a disc extrusion. The most frequently affected intervertebral disc in our population was L7-S1, followed by the thoracolumbar junction, so the disc from T11 to L2, and L4-L5. These findings are in agreement with previous with the higher predisposition of this feline spine location to intervertebral disc herniation. And this finding probably could be related to the peculiar vertebral column configuration. Interesting, none of our cats was affected by intervertebral disc herniation in the cervicothoracic spine. Likewise, there was no report of C6 disc involvement among all published feline cases. So this low susceptibility to intervertebral disc herniation of the cervicothoracic spine could be related to the range of motion and stance configuration of the feline spine. According with this study, this radiographic study by McPherson and colleague, they show that the cervical column of cats is highly mobile, especially in dorsiflexion, and that the other flexible spine region, the thoracic one from T4 to T11, is a flexible region that enables cat to undergo extreme torsion. Between this region, trunk muscle insert near the T2, T3 joint as a sling-like arrangement that we can see in this picture, and help to stabilize the spine, particularly against rolling movements. It has been supposed previously that this T2, T3 stability could contribute to local incidents of intervertebral disc herniation, mainly after trauma. So it's possible that the specific organization and mobility of the spine, combined with the proximity to a more stable area at T2, T3, could protect the cervicothoracic intervertebral disc from degenerative changes. At least feline intervertebral disc herniation have been reported mainly as single lesion, with only 7.5% of cats having more than one intervertebral disc involved. We found in our study the same distribution, with only 4 out of 43 cats affected by multiple lesions, so 9% of cats, and all were diagnosed with intervertebral disc protrusion. This finding is in accordance with these previous studies in dog, in which the presence of multiple compressive lesion was associated with a diagnosis of intervertebral disc protrusion. The limitation of our study were the retrospective nature, the relatively small simple size owing to the infrequent occurrence of disc herniation precluded the detection of multivariate statistical significance of some factors. And another limitation was the different type of MRI scanner used, as we know that the strength of magnetic field influences the image quality. And for the last point, we found that in only 2 cats, an intervertebral disc herniation that was outside the spinal cord segment of the neurolocalization, but included in the MRI field of view. Both these 2 cats were diagnosed with intervertebral disc protrusion in the clinically affected segments, and also the additional intervertebral disc herniation was a intervertebral disc protrusion. It's therefore possible that our cats affected by intervertebral disc protrusion could have presented more protrusion along the spine, leading to a possible underestimation of the real prevalence of this protrusion in our population of cats. In conclusion, intervertebral disc herniation should be considered an uncommon disease in cats. However, this study had significant information to the limited available data about this condition in cats, highlighting that the acute non-compressive nucleus pulposus extrusion could occur more frequently than previously reported, and that the cervicothoracic spine is a region not affected. The thoracolumbar and mid-to-caudal lumbar region are the most affected region of the spine by intervertebral disc herniation, and each type of intervertebral disc herniation is associated with distinctive clinical pattern, and certain clinical features like spinal hyperesthesia and onset of clinical sign are useful feature to discriminate between this condition. Moreover, the number of the affected intervertebral disc could be indicative of the type of intervertebral disc herniation. So we saw that the involvement of a single intervertebral disc is more frequently associated with the acute non-compressive nucleus pulposus extrusion compared with multiple intervertebral discs affected by intervertebral disc protrusion. Thank you for your attention, and I will be happy to answer to your question. Thank you very much.
Thank you very much, Leonardo, for this great presentation. We're just going to wait for a little bit of time for the questions are slowly coming. I think there's one from Bay. I'm going to put it so you can read it as well. Did you find that clinical outcome for cats that underwent surgery for invertebral disc herniation was consistent with previously reported data?
It's a good question, but unfortunately, we didn't evaluate the outcome of cats and treatment because the information about treatment and so outcome are lacking for in our population of cats. So unfortunately, we didn't evaluate this factor.
Maybe it'll be another study to do.
Yeah.
Using that.
The other cats.
A question from Kuhn. Dear Leonardo, thank you. Based on your included MRI studies, do you have any feline-specific tip for MRI sequence to be performed in case of intervertebral disc herniation?
No, the MRI study included at least T2 and T1 weighted images. So we think that these 2 sequences are sufficient for the diagnosis of this of intervertebral disc herniation. So we didn't use additional sequences for the diagnosis.
Okay. I will just add, make sure you do a post-contrast study, especially with fat saturation, in this case, especially for the excretion. I think it's quite useful, to do.
Unfortunately, we use the high field MRI only in the last 2 years of the study. So before it was very difficult with a low field MRI to.
And the time as well, and so on. Waiting for more questions. I can't remember. Did you have any intramedullary disc extrusion in your study?
No, we didn't.
You didn't.
No.
Because obviously that's the question. Some of the cases that are labeled as acute non-compressive nuclear pulposus extrusion, are they truly that, or could they be intramedullary disc extrusion? And this acute non-compressive nuclear disc extrusion, they all had, at the level of the lesion, an hydrated disc, or the disc was not hydrated in some of them?
So the disc, we found a reduced T2 signal of the disc herniated. So the disc for us was hydrated in all the cases.
Because it's not, from what we see, it's not that common, but often we see, degenerative disc with an hyperintense lesion, and obviously it's not an hydrated disc. I mean, all the discs are dehydrated, or a lot of them, so it's not an hydrated nucleus, but maybe, it will fall into the category of traumatic disc herniation or extrusion with, low volume, minimum compression. That's the, especially in older cat. I remember vividly a cat having 2 discs in the lumbar spine, having hyperintensity in 2 different areas, but he was like an 11-year-old cat, so the discs were, degenerated.
Yeah.
Let's see if there's any. Simon, I don't know if you have any question.
Yeah, just on that subject, the acute non-compressive nucleus pulposus, you mentioned in the paper that you used the Spinal Cord Injury Consortium classification. Would you be able to expand a little bit on the criteria that you had for the acute non-compressive versus how you gained some confidence that wasn't a fibrocartilaginous emboli, for instance?
So,
does that make sense?
We use the MRI criteria previously published in Frontiers, for example, in 2020, the review about intervertebral disc herniation.
Yeah,
I don't understand the question. I'm sorry.
Yeah, just for the listeners, could you expand on what it was that you looked for, what that criteria suggests for the acute non-compressive nucleus pulposus? What made you say this is acute non-compressive nucleus pulposus versus fibrocartilaginous emboli?
So the aspect of the intervertebral disc, so the reduced signal on T2 and the extension of the intramedullary hyperintensity. So this is a point, a critical point of our study, because sometimes it's difficult to differentiate between acute non-compressive and ischemic myelopathy.
Right.
But we base our criteria on mainly on the extension of the intramedullary hyperintensity on T2.
So you mean where it's centered?
So the shorter intramedullary hyperintensity underlying the changed intervertebral disc is useful for us for a diagnosis of the acute non-compressive nucleus pulposus extrusion.
Okay, great, thank you.
I'm going to take one more question for you from Bulgaria, from Mitko. Have you ever seen a disc protrusion at T3, T4 in this study?
No, we didn't found any disc herniation in the upper thoracic spine of the cats. No.
And the last one from Kuhn, because you had a large group of acute non-compressive nucleus pulposus extrusion. Any feel that you could give, even if you was not part of the study, on how do they do with cats, you know?
The feel was good for the
Yeah.
cats. So the outcome usually was good for all the cats with the acute non-compressive nucleus pulposus extrusion.
And I will share that. I mean, I've always been impressed, you know, that cats tend to do much better than the dog, and he a proof that they have 9 life and they're lucky, but you never know how many they use, you know, in their spinal cord injury. That's the only thing. So,
Yeah.
but thank you very much, Leonardo, for this presentation and for you know, taking the time to share all that with everyone. We had people from, you know, all over the world, including South America to Sydney. So quite a lot of people, and you know, many people will listen as well. The recording that will be on the Facebook page straight away. So if you haven't, you know, watched the presentation, if you want to listen to it again, it'll be available, and Simon will also post it on the as a podcast. We started, you know, there was a post last week with the podcast as well. So if you are sick of listening to the same music when you go running, and you have the opportunity to listen to neurology or neuroimaging lecture, and especially Leonardo, it gives you a good rhythm for the run. But thank you very much.
Thank you.
I leave the last word to Simon.
Yeah, thank you, Leonardo. Very good
Thank you.
presentation and good study. Thanks to you and all your team involved in that. Thanks for giving up the time to come here. Really appreciate that. As we said, Leonardo is one of the rising stars of the profession. So if you feel you have a recently published neuroimaging study that you would like to present using this forum, then please get in touch with us. Thanks again to Hallmark Advanced Veterinary Imaging for sponsoring this session. If you don't have anything to do in August, then join us again for the next Webinar Journal Club. Until then, see you again.
Yeah.
Bye bye, everyone.
Thank you. Bye.
Bye-bye.